As far as whenever doing the cephalic catheter, the catheter, if it is out of the vein but still in the skin, consequences of that are going to be the catheter is going to blow up, all that fluid's going to go underneath the skin, kind of like sub-Q fluids would be, but in a place that we would not do sub-Q fluids. The faster you notice it, the smaller it's going to be, the better it's going to be. It could become very uncomfortable to the dog as far as that fluid blowing up, like in a leg area where there isn't a lot of resistance for stretching. And as far as the amount of time a catheter should be in a leg is 48 hours is usually kind of your standard, or as an as needed basis. So as far as 72 hours is the absolute max. A catheter needs to be changed at that point, whether the animal's going to remain in the hospital or not. As far as daily, dressing should be removed in the site. The catheter site should be inspected. You should look for signs of infection, and then signs of, I may be saying this wrong, but like phlebitis, and that things are that are going to cause that are urethemia, swelling, tenderness upon palpation of that leg. There will be an increase in the size and the temperature over the vein. So those are just things that should be watched for when you unwrap the dressing. The dressing should be dry. Everything should be dry, like as you wrap it back up at that point too. You're looking for things as in discharge. There should not be any discharge from where that vein is. And as far as once you dress it, put the dressing back on the leg, there should not be any swelling on anywhere on that leg. The swelling is a sign of the bandage being too tight. If the patient is tearing up the bandage, you should be looking at that bandage. Why is that animal messing with it? May just be an ornery dog. Maybe that he's trying to give you a sign that there's an issue that needs to be looked into. Catheters not being used for continuous fluids should be flushed every 4 hours with 4 units per ml of heparinized saline. So that should be done every 4 hours, or after unhooking them. We always flush the catheter and before hooking them back up. And that's just going to make sure that there is a flow of that catheter still being in. A lot of times you can kind of feel, like if it's on the leg, you can kind of feel up higher and you can feel it go in. You can also pull back and get some blood in there. Things as far as deterring chewing is there is a vet wrap that has bitter apple manufactured into it. Also, a piece of vet wrap can be placed over the port. For the most part, a sick dog we find doesn't care about the catheter being in the leg. And in my experience, you only have to really worry about them pulling out the catheter whenever they start to feel better.